This chapter covers integumentary or skin diseases and disorders. The skin includes hair, nails, and um, glands with a huge number of nerve ending receptors. The role or the function of the system is to protect, to give us sensation, and in the synthesis of vitamin D from the sun. Uh, and it also helps us to keep our body temperature regulated to a normal and functional level. The skin's one of the largest organs and it protects us from infection. We've looked at that in the chain of infection and in from toxic materials or other things that might want to harm the body. This slide's basically just a review, but the layers of the skin are the epidermis or the outer upper layer of the skin, if you look at it from a med term definition. And the second layer is the dermis, which we find in the middle of the skin layers. That's where we have our connective tissue that gives us our elasticity of the skin. And then we have the subcutaneous, which is the layer that contains fat, the body fat, and um, helps to insulate us against um, temperature changes. When we talk about lesions, it's a very generalized term. It's basically abnormal or damaged tissue. It can be from injury, it can be illness, it can be infection, it can be any number of reasons as a cause. And typically, it can also be inside the body or outside the body. And typically, um, you can have a flat mole or an elevated, um, more like a pimple, or you could have a bump or a nodule. And this is all looking at the skin itself. So within those types of skin, we have a macule, which is just a different color on the skin than a normal color. So if you have little areas that are little dark spots or those kind of things, that might be a macule. A papule is a small, firm, elevated lesion. So the difference in these are they're a little bit raised. A nodule is again one you can feel, and it is also elevated. The difference between nodule and papule is a papule is going to be small, it's going to be firm, whereas the nodule may not be firm. A pustule usually has some kind of pus-like material within it that can also, if that skin breaks, it can leak out. Vesicle is more of a blister-like lesion. Plaque is an elevated lesion, but it's also has a little scaly surface to it. A crust is sometimes you can have a lesion that maybe has been open to a certain extent and that has dried and kind of sealed off on the top with a little crust. Lictification is a dry, thick, rough area on the skin. A keloid is basically an overgrown scar tissue, basically. It's increased its mass, usually in thickness and in depth, uh, from something that has been a scar previously. A fissure is more of a crack-like area in the skin. It can be small, but it can have some depth to it. Um, a fissure might be when your fingers get really dry and you get that crack on the edge of your tip of your finger. That could be considered a fissure in the skin. Ulcer is a cavity with tissue loss. It's kind of the surface of the tissue is gone and it's created a little cavity within it. Erosion is typically it's kind of wearing away of the surface tissue of the skin. Um, so it's kind of a cavity also, but it's kind of got that way from something eroding it away. Comedo blocks the opening of a hair follicle. Some additional terms are cutaneous lesions or eruptions on the skin. Um, Puritis is itching, pain. I think you have that one already. Edema is swelling. Erythema is redness. Inflammation will show some erythema, for instance. And then inflammation has not only the redness, but it shows swelling. It sometimes has tenderness, so it has multiple things that go with that one. Dermatitis is basically an inflammation of the skin, and it can be for a number of different reasons. Three types: seborrheic dermatitis, contact dermatitis, and atopic or dermatitis or eczema. And the common signs and symptoms for it is itching or pruritus, erythema, redness, and different variations of skin lesions themselves. Seborrheic dermatitis is one of the most common skin disorders. It's typically an inflammatory condition, usually coming from the oil glands or the sebaceous glands of the skin. Um, Most commonly, it's going to be on the scalp or eyebrows or beside the nose or behind the ears or those kind of areas. We can see it as cradle cap. Um, we see it more in patients who have Parkinson's disease. Um, and basically, from the irritation and all of that factor is usually what brings a patient in. Um, they'll have a gradual increase in the sebum produced. Um, they get inflamed. Um, the skin turns red, and then they develop a yellowish, greasy looking scale. And again, we could see this in cradle cap, usually in early infancy as well. This generally is thought to be idiopathic, no known cause, but it's possible it may be coming from a certain type of yeast organism. Um, Usually, one of the things they can give for this is steroids, but um, they because of the um, side effects of steroids, they don't like to give it for long periods of time. Um, if it's in the scalp, then shampooing would be something that's beneficial. Um, Most will go away on their own, but typically cortisone or hydrocortisone cream is what's used. Um, and with cap, they're going to be gently removing the cradle cap from the skin just by gently massaging it. It will kind of abrade it off a little bit that way.